My name is Dr. Joel Fechisin. I'm one of the many orthopedic surgeons at Seaview Orthopaedics. I specialize in adult reconstruction, which specifically entails doing hip and knee replacements. Here you can see an x-ray of a knee, and we have the bottom portion of the femur and the top portion of the tibia. And you may notice that there is a space in between those two bones. Out on the outside, the space is relatively well maintained, but on the inside, you can see that that space has completely disintegrated. That indicates to us that there is severe degenerative arthritis of this joint and that the cartilage that used to live there is completely gone. This is a joint which would be a candidate for a joint replacement. And the joint replacement itself involves cutting of those arthritic surfaces to expose fresh bone that we then place new metal implants on. And you can see that over here. In between those two metal pieces is a very specialized piece of plastic called a polyethylene, which acts as the new joint space and allows the joint to function correctly. One of the particular reasons that a person would need a joint replacement is if they were having persistent pain in the joint. Now, pain is not the only symptom that a patient might be having if they have degenerative change. They may also experience swelling, loss of range of motion, or sometimes instability. The best time to consider joint replacement surgery is if you're having consistent discomfort, swelling, and instability, and have previously failed non-operative treatment measures that we do offer through the office. Non-operative treatment includes physical therapy to work on strengthening and endurance, different types of anti-inflammatory medications and analgesics to try to control inflammation and swelling, and any number of different types of injections, whether it be cortisone, viscosupplementation, or even more advanced injections like PRP or amniotic fluid. There are different types of total joint replacements that are available. There's a total joint replacement, which would address all of the compartments of the joint, as opposed to a partial joint replacement, which would only address one of the particular compartments in the joint. There are three separate compartments of a knee: the inner aspect, the outer aspect, as well as the compartment in behind the kneecap. Depending on how many of those compartments are affected would determine whether a patient is more appropriate for a partial knee replacement or a total joint replacement. In today's day and age, we are seeing younger and younger patients coming to us with more advanced degenerative changes of their joint. There are situations when it would be too soon to have a joint replacement. Generally, we like to see patients in their 50s or 60s who demonstrate that they have severe degenerative change of the joint itself and have previously failed non-operative treatment options. Getting a joint replacement too soon or at too young of an age may result in breakdown of the joint over the course of their lifetime and an increased risk of needing a revision procedure of the knee, which can be far more complex and far more complicated for the patient themselves. I would say that the only risk in terms of delaying a total joint replacement would simply be that the patient is going to continue to experience limiting discomfort and difficulty with their activities of daily living. As the joint continues to break down and they lose range of motion, it can oftentimes be difficult to regain that motion even after the surgery. Anyone who is giving consideration to joint replacement needs to have a long, detailed discussion with their physician about what the condition of their knee is and what types of treatment options they've been through to this point. If they have failed non-operative treatment measures and are simply having too much pain that they can't get through their activities of daily living, you may very well be a candidate for a joint replacement, and we would encourage you to come to Seaview Orthopaedics to have that discussion.